Hi there, Sandra Wallace, the OCD coach. Just wanted to come on and share some exciting news. We are going to start a mini-series education on OCD, from everything from the definition of OCD to the risk factors to the causes to the various types and coping strategies, and also some tips for family and other loved ones supporting someone going through OCD. And also, of course, the importance of working with a coach, a therapist, one-on-one with living with OCD to get the best results and maximize your outcomes in a positive way. So what I wanted to start with is often when I'm working one-on-one with clients, they ask me, do I have OCD? I don't know if I have OCD or something else. So some of the main criteria necessary to be aware of whether or not you have OCD is some of the things I'm going to talk about tonight. It's not an exhaustive list, but it's some of the important criteria that are part of diagnosing someone. Now, when we diagnose, it's important that we also seek a professional help to be diagnosed, and someone who is an expert in obsessive compulsive disorder. So let's start with the O, the obsession. The obsessions are persistent and recurrent thoughts, they're urges or impulses. Now, these things that are happening within the brain are intrusive, they're unwanted, and they create tremendous anxiety. So what we tend to do living with OCD is we want to suppress that. We want to ignore or neutralize it. So we do not want to have those things present in our mind. So how do we do that? Sometimes we think of something else. We use distractions. We move into another action so that we are not focused on those thoughts or impulses. Now, the other thing is when we have that anxiety, we feel compelled to do a compulsion. We feel compelled to do some form of behavior, whether it's mentally or outward, to decrease the anxiety and to make us feel better. And that's what we refer to as the compulsion, the C in the word OCD. Now, compulsions and rituals are used interchangeably, but they are some form of behavior. Now, when we do a behavior mentally, it's a little bit more difficult to detect for people on the outside. So let me give you an example of a mental compulsion. We may say things in certain numbers. So we may pray 3 different prayers. We may count 3, 6, 9, up to a number that feels just right. And when we live with OCD, what feels just right this time may not be the same as the next go around when we have the urge to do a compulsion. So that's really important to know. The patterns and the behaviors can change from one time to another. So the only way we really know if someone's doing a mental act is we need to ask, because a lot of times it's really hard to see from the outside. Now, all of these compulsions or rituals that someone does are intended and focused on preventing a dreaded event or situation from occurring. Even though we know in our minds it doesn't make sense, the OCD tells us we need to do it. So we are in touch with reality, but the urge is overriding us with our obsessions in order to feel compelled to do the compulsion. So it's not realistic a lot of times, but it's necessary. So that's a really key point as well. The other risk factors, so that's a bit about OCD. Now I want to get into risk factors and causes of OCD. No one knows for sure what the causes are of developing OCD, but there are a few things over time that research has shown that if we have a predisposition to OCD, which is a genetically inherited genes, then we can develop OCD. It doesn't mean we will, but we can. Also, other things are brain abnormalities, specifically serotonin and norepinephrine, the neurotransmitters in a specific part of our brain. Those could be cause for OCD. Now, our environment, sometimes it's learned behavior. So if we had someone model it growing up, if your mom or your dad or someone in your household was always checking the stove, checking the fireplace, checking the outlets and those sort of things, the doors, being role modeled to us, we can also develop it. Now, the risk factors also are stressful life situations. Many of the people I work with have developed what we call PTSD, post-traumatic stress disorder. So that could trigger it as well. So stress is a big factor. Stress doesn't cause OCD, but it will actually exaggerate it or bring it out to the forefront if we're under a lot of stress. Another thing is what we call dual diagnosis. So some people living with OCD also live with another mental disorder. OCD, anxiety disorder, depression. Those can live all together simultaneously and be happening all at once for a person. Now, not everyone with depression or anxiety has OCD, but most people with OCD have anxiety. That is for certain, and also depression, because the obsessions are just so intrusive and debilitating at times in their life. So those are some of the risk factors. So what I always say is early detection, early diagnosis goes a long way in helping a person on their recovery process. So lastly, I will just mention that we're going to talk next time we meet on the different types of OCD, because there's so many. So thanks for listening. If you want to get more information, visit my website at www.theocdcoach.com, and we will also put this up on YouTube. So share it with people, as many people as you think that could benefit from it. I work with obsessive compulsive disorder, anxiety, and depression, and the treatment modality is the same for each of those. So I will meet you there.